My name is Brittany Harnish. Today we're going to be talking about the proper way to secure nasal cannulas in the neonatal population. The title here is the effect of nasal continuous positive airway pressure, or NCPAP, device securement on nasal injury in the neonatal population. So our intended audience is registered nurses working in the NICU, or the neonatal ICU. Also, this lesson is intended for respiratory therapists who work with patients in the NICU. Finally, registered nurses who work just in the children's hospital that float to the NICU should review the content of this video lesson. Okay, so our objectives here are at the end of this learning activity, the nurse will understand why proper securement of RAM cannulas is important in the neonatal population. Also, at the end of this learning activity, the nurse will correctly identify proper securement of RAM cannulas on a neonate. Oh, went a little too fast. So the goal of this lesson is to reduce the incidence of nasal trauma and negative sequelae in the neonatal population. So here's our clinical problem. NCPAP used for respiratory support following endotracheal intubation has been shown to improve outcomes and help prevent chronic lung disease in neonates. Though NCPAP can improve outcomes in neonates, the apparatus used to deliver this respiratory support can cause nasal injury. Preterm infants are at high risk for developing pressure ulcers due to immature skin, exposure to medical devices, nutritional deficiencies, and exposure to ambient humidity. These patients typically require respiratory support for long durations, which also increases their risk. Nearly 43% of patients using NCPAP develop some type of skin impairment on their noses. So here's our interest in the problem. Nasal trauma is a source of discomfort and a possible site of infection. Also, there's a risk for long-term functional or cosmetic sequelae. In some cases, the patients require reintubation for mechanical ventilation, secondary to loss of nasal tissue and bleeding. This increases length of stay for patients and families. Pressure ulcers related to positive pressure devices in neonates is important to the nursing profession because pressure ulcers are a nurse-sensitive indicator. So here's the types of studies I looked at. 3 of them were random controlled trials. They compared the types of delivery devices or securement methods. One study employed a prospective operational design in order to evaluate the incidence and severity of nasal trauma secondary to NCPAP in neonates. And the remaining study utilized a descriptive and cross-sectional design to determine the frequency of nasal injury in newborns through the use of continuous positive airway pressure with prongs. So based on that, we've got some recommendations here. Measures to prevent nasal trauma must always be taken. Meticulous assessment of skin by nurses and early interventions will provide the best outcomes for neonates. A scale should be used by the nursing staff in order to more accurately assess skin breakdown and properly manage care. In addition to prevention, the literature shows that using a barrier between the neonate skin and the NCPAP device, the severity and or frequency of nasal trauma can be decreased. Specific research needs to be conducted on which barrier method is the most effective. The two described in the studies I looked at were a hydrocolloid dressing or a silicone gel, and they both had positive effects. Also, there needs to be more research conducted to evaluate the effectiveness of various methods of delivery. So take a look at these photos here and look at the way these are secured. Their nasal cannulas are secured. And take a look and tell me which one you think is secured correctly. Okay, so the one on the right is correct. You can see that there's a hydrocolloid barrier in between the skin and the device. This one does, the cannula looks a little different, but there's nothing in between the skin and the device. So there's my references.